I would now like to welcome our next speaker, Mr. Mohammad Shoriful from Save the Children Bangladesh, who's presenting on piloting the management of hepatitis C virus infection among HIV-positive people who inject drugs in Bangladesh.
Good afternoon, everyone. This is Sharif from Bangladesh. I'm working Save the Children in Bangladesh. Now I am sharing a small pilot study which is conducted in Dhaka. Basically, Bangladesh HIV program is funded by the Global Fund, and for the long period of time, Bangladesh is funded by the Global Fund, but hepatitis C treatment is absent in Bangladesh. So basically, HIV treatment, when we ask funding for hepatitis C. However, hepatitis C prevalence is very high in Bangladesh among the people who inject drugs. But the funding, but the funder is not convinced because this fund is for TB, HIV, and malaria. So I am sharing. That's the reason I'm sharing the background of this piloting. We just initially started the piloting with the people who are living with HIV. Since the funding is for HIV, so we wanted to have starting with this pilot with HIV funding. And Bangladesh harm reduction program is very next. So harm reduction program in Bangladesh. Harm reduction program in Bangladesh is very old. And it has been 1998 when harm reduction program was started in Bangladesh, but there is no opportunity of hepatitis C treatment. And among HIV positive people, this has been a significant impact because they are not treated for hepatitis C virus. And with this background, basically we started this piloting under Global Fund NFM3 grant. And the main objective was to assess the feasibility of diagnosis and treatment and to scale up for a next grant. In Bangladesh, there are 64 districts, and out of 64 districts, harm reduction program is operated in 31 districts. And this study was conducted in 3 districts. 3 districts considering HCV RNA testing facilities, and also 3 districts have a significant HIV epidemic. And there were 740 target population for this piloting, and we have developed a guideline and also some form formats for this pilot study, and the staff who are engaged with the treatment, and they have been provided orientation, and national network of people who use drugs also engaged for community level follow-up and treatment. And we also engaged Center for Disease Control under the Ministry of Health. They are for ensuring support from hospital-based activities. And as I mentioned earlier, our target was 740, and we have been able to provide screening only 704, and out of 704, 288 was found antibody positive, and that is around 40%. And also, out of 288, 177 was sent for confirmatory test, and with this number, we have found 144 RNA positive. And that is also huge RNA positive, and we provided treatment for 131, and 166 completed their treatment. And out of 166, 111 number, we conducted a follow-up test after 3 months, that is SBR12, and with this number, we found that 87, that is around 80% cleared virus, meaning that they did not, they are not virally detected for hepatitis C. Since it was piloting and the main objective was to make them understand this treatment feasibility and also the integration of piloting with a harm reduction program, and this has been was very successful, and under a Global Fund GC7 grant, it has been now integrated, and the Global Fund grant now providing Hep C treatment support for the people who are using drugs. And that is the main success of this study, and the government of Bangladesh has also taken this pilot study for further expansion and scale up. Thank you all.
Thank you so much. Are there any quick questions for Mohammad? No. That was a very impressive presentation and a very impressive program. Can I just request, oh, there's a question. Matt.
Yeah. Arun? Hello. Can I have a question? When you said that the Global Fund is going to fund it, do you know what the price that you've negotiated for the DAA is in Bangladesh? And can I just clarify, it's not just for people with HIV, it's for all people with hepatitis C in Bangladesh?
So what do you mean, treatment cost?
Yeah.
It's per person around 30,000.
30,000 pounds. What's that in dollars? Sorry, in dollars.
Oh, sorry. Sorry. It's about 300 USD.
Brilliant. Okay, thanks very much. And that's for how many treatments have they ordered? How many people are you going to treat with the new program? Or is it unclear?
How many?
Yeah.
Oh, it was targeted basically for GC7 grant or earlier study.
Okay.
Oh, it's about 5,000 PVD who will be treated for hepatitis C. Okay, thank you.
Brilliant.
Lovely, thank you. Can I just request that because we're now in the 5-minute presentations, that the timing on the screen gets updated?
Okay.
All right.